Do you love waking up early in the morning, struggling to figure out what to do with your hair? We've all had our share of bad hair days. Are you ready for a change? Lock it and love it with Lock and Love Salon, conveniently located at 8117 Liberty Road, Windsor Mills, Maryland. Start your lock journey today. Lock and Love's professional services and artistic designs will keep you blazing in the hottest trends while maintaining and protecting your hair. Honey, Lock and Love is an experience. Once you try Lock and Love Salon, you won't try anyone else. Lock and Love offers starter and maintenance locks, fox locks, detox, shampooing and conditioning, lock treatment, lock extension, coloring, and much more. Sorry, but Lock and Love doesn't accept walk-ins. What are you waiting for? Call 410-970-3791 to set up your appointment today. Lock and Love is on Facebook, so remember to like, follow, and share.
And welcome to the Blue Scrub Club show. I'm your host, Dr. Charlene Harrod, a womaner, better known as a nurseologist. And tonight we are celebrating the heartbeat of healthcare, our nurses. This is currently Nurses Week. It started yesterday on May the 6th and it runs through May the 12th. So, what we're going to discuss tonight is how to thank a nurse. What Nurses Week means, the different level of nursing specialties, the importance of appreciation. And as always, communities can honor nurses for their dedication and sacrifices. What is Nurses Week? Nurses Week is a celebration every year from May the 6th through May 12th, ending on the birthday of our nursing pioneer, who is Florence Nightingale. It is a time dedicated to recognizing the compassion of nurses, their commitment to patient care, their sacrifices from their families and their friends, and not being able to take off from work through holidays and some times of the year, their long hours and their emotional strength, their impact of families and communities. So, a little bit about some talking points. Nurses are often the first and the last person that a patient sees. Nurses advocate, educate, comfort, and save lives. Nursing is more than a profession, it's a calling. Nurses work through holidays, emergencies, disasters, and pandemics. And as far as the pandemic, it showed us back in 2020 up until basically 2024, late 25, how a pandemic can change the lives for families, nurses, and communities. And it is so important that as, we as people in a community learn to appreciate those who sacrifice their lives to help us be able to enjoy our family and friends and their lives. Some people say that nurses chose that job. I don't think so. I've been a nurse for 26 years. I didn't choose this job. God chose this job for me. For me being a compassionate, caring, person that shows empathy and compassion to everyone, including people who are not so very nice when I am at the bedside alongside them, because you can't, when someone is ill and they're dealing with an illness, we also have to wonder, how are they feeling? That's some of the things that people don't think about. They don't think about how the patient is feeling. The patients are going through a difficult time in their life as well. And with that being said, we always should try to place ourselves in their position. When we are being told that we are not as healthy as we thought we were, and being given some un we're being given some news that aren't good, it tends to put us in a place, you know and with that being said, I think everybody needs to take a deep breath, whether it be the nurse at the bedside, the doctors, or any healthcare worker at the bedside. You need to put aside your differences and think about how the patient is feeling. And that is so important when it comes down to us being able to care for the patient and the families. You know, when you're in a hospital and you're working, you don't only have that patient to care for, you have their visitors, you have their family members, you have extended family members that you have to answer to as well. But the greatest thing that nurses are taught in school or during their training is, if the patient don't give you the right to discuss their medical condition while they have visitors, the patient has that right. And nurses, we are very good with answering questions, but we're also great at referring back to our patient to give family information if they want to share that information, because it is so important that we protect our patient. Protecting our patients are so important when we're working in healthcare. And that is some of the things that we generally have to think about, because when it comes down to patient care, it becomes a little sticky. And we have to be sure that we don't violate our patients. And And we have to be sure that our patient information remains confidential. That is the important part about that. Let me tell you guys a little bit about Florence Nightingale. She was an English nurse, statistically, who was widely known as the founder of modern nursing. She became famous during the Korean War for improving sanitary conditions and reducing the death rate amongst wounded soldiers. Important facts about Florence Nightingale: she was born May 12th, 1820, in Florence. She died August the 13th of 1910 in London. She was also known as the lady with the lamp. So if anyone wondered why the lamp came into play with nursing, that was a little bit about Florence Nightingale and her service that she gave to that profession. She carried for soldiers at night a lamp through the hospital wards so that the bright lights wouldn't be beaming all day long and they wouldn't know the difference between night and day. She believed that nursing was a calling and fought for better health care, cleanliness, education, and most of all, patient care. Her major contributions was improving hospital sanitation and infection control, She established a professional nursing education. She opened the Nightingale Training School in 1860. So that just gives you a little thought process behind how long nursing and the education have come. She used statistics and charts to improve the healthcare system, which is a part of what being used now. She inspired nurses around the world to provide compassionate care. That is so important that we need to give compassionate care to our patients and their families. Some of the things that Florence Nightingale represented was number one, compassion, dedication, leadership, and service. Nursing Week is celebrated around her birthday, which is May 12th, to honor nurses and their impact on healthcare worldwide. So, that is the reason why we celebrate nursing as Nurses Week during that time, because we want to give that special thanks to a nurse who sacrificed herself to work for those soldiers to be sure that they would have a better outcome. What do you think people misunderstand most about nursing? If you can share that point with me in the chat, I would very, very much thank you for sharing that. And I will, on my YouTube channel, answer the question, and also give some of your responses from that question. So I will repeat that question again. What do you think people misunderstand mostly about nursing? And if I can't answer that question, I'll be sure and ask a couple of other nurses what do they think as well, so that we can have a conversation about that. Now, today we're going to talk a little bit about how to thank a nurse for their service. It is so important that we thank people, or shall I say, thank the nurses who care for our loved ones. It is a simple way that nurses feel very appreciative. It could be a thank you card, or it could be just you verbally saying thank you to that nurse. You can write an appreciation card. You know, nurses and that work in the hospital, the administration, when they receive correspondence or letters or anything thanking a nurse for her service, they really share that on their website, one. They also share it with the department, two, so that that nurse manager can share during her meetings um what the family felt when they came on a unit, and how they remember certain nurses who did certain things that were exceptionally special for their family members. When providing meals and snacks, you have to be very careful. You might want to talk to the charge nurse in a hospital setting before you decide to bring in either a meal or snacks for the staff, just to be sure that it's okay to bring those things in. Giving nurses flowers are okay, but when it gets down to gifts, nurses can't accept high dollar value gifts, and it has to be approved either through administration, the nurse manager on the unit. We have to be very, very careful when you are giving a nurse, or contributing to Nurses Week, and just celebrating your nurse that works for you. It's very, very important that you show them some generosity for caring for your loved one. Prayer for nurses. Me as a nurse, every day before I leave my home, when I'm on my way to work, I pray. I generally get to work early so that I can pray for my day, Pray for my hands. My hands are very important to me in nursing because in nursing, I use my hands to care for my patients. And I really, truly have to bless my hands daily. That is something that I have been doing ever since I was a CNA, and that was many, many moons ago. So I became a CNA back in 1989. That's just to give you a little bit of background on me as a nurse in my career. I started off as a secretary at John Hopkins Hospital. And then I went back and got my CNA, and I've worked in several hospitals in the Baltimore, well, I would say in the Maryland area. And then as I went through working as a CNA, I decided to go back to school to advance, and I advanced to a licensed practical nurse where I've been for 26 years. Um, would I go for my RN? Right now, where I am safe. I am happy. Every time you go up to a different level, you have different responsibilities and you take on more responsibilities as a nurse. Right now, I am comfortable as a licensed practical nurse. I've been a licensed practical nurse for 26 years. I love the work that I am doing. I love working in pediatrics and emergency care. I have been taking care of pediatric patients even as a CNA, but more so as a licensed practical nurse. That was the field that I felt the most comfortable in, and providing care for younger people is my passion. What better for me, what's better for me is to take care of young people because I get to play all day with them. And in playing with them, I begin to educate them and they educate me as well. Respect healthcare workers. You know, they work very, very hard to care for your loved ones. They work very, very hard to advocate for your loved ones. That is one of the best parts of being a nurse, is being able to advocate for your patient. You know, to let your patient feelings and give them the proper education that they need, especially during a time where they are most vulnerable. You know, sometimes the doctors and other healthcare workers come in and the patient don't really understand in layman terms what's going on with them. And nurses, you know, we have been trained how to communicate with our patients and how to communicate with other healthcare workers, which is a plus on our side because we can advocate for both sides of the healthcare system. We can advocate for the doctor side of the healthcare system, more so advocating for our patients and being sure that they're getting the proper care that they need. The other thing is with community support, you know, support mental health for nurses. Nurses have been, you know, trained to care for people, and depending on a situation, no matter what the situation that we're being faced with, we're always taught to learn to manage our composure. You know, the thing about nurses is it takes a lot to be a nurse. Some people say that nursing is an easy job and that they can do it. Well, I am here to tell you that there was nothing easy for me through nursing school. There was nothing easy for me to care for patients. You know, yes, I do believe it takes a special person to be a nurse, um, with certain qualities. And being able to advocate for both sides it's really a challenge. But with the type of education that nurses are given, um, it's really, really tough to become a nurse. Not to mention that LPNs, LVNs, RNs, nurse practitioners, DNPs, when you first take the nursing courses, you know, um, before you can become licensed, you have to take the NCLEX. The NCLEX is no walk in the park either. You can't determine how many questions you're going to get. And the more time that the NCLEX has changed. Before it used to be multiple choice questions. Now they have some fill in the blank questions. So not only do you have to really study for that NCLEX exam, you also have to remember that it's not an easy task. And every class that you take, from the beginning of your prerequisite classes all the way through nursing school, whether it be through the practical nurse program or whether it be through the registered nurse program, whether it's a ADN, which is an associate degree program, or a BSN, where it's a bachelor's degree. Then when you get into specialty care, some of those specialty cares have licensures exams that you have to pass also. So when it comes down to nursing, it is a career that you always have to stay educated, and as you move further through your nursing career, you'll always be taking some type of licensure exam in order to advance yourself into a specialty. Recognize nurses publicly. We have a lot of social media platforms out here just to say thank you to a nurse. I have been, you know, on social media for a while, and um, this one particular social media platform that I saw was a gentleman who was thanking nurses for what they do. And his wife was a nurse. He had a flower. He said that he wanted to thank nurses all over the world for the service that they do. And he wanted to be able to give a nurse a flower while she was alive, and that she could hear his expression on how he felt about nurses. I think that that was very special for that gentleman to not only recognize his wife as a nurse, but to also recognize other nurses around the world. It took a special person to do that. You can donate self care items to a nursing department or to a facility. You know, donations are always accepted at these facilities. And, in some facilities, such as the long term care facilities, you could come in and volunteer. While you volunteering and telling the nurse thanks for her service, that is another way that you can give back to the nursing community by volunteering and helping to feed some of the residents in the long term care facilities. It's never enough hands to help during that time. And that would be a way that you could give back to nurses and say thank you for your services as well. The other thing is you can offer scholarships to certain facilities and hospitals. You can donate and let them know that your donation that you are making is specifically for the future nurses. You can volunteer your services at a high school. High schools have students that are taking certified nursing careers or other healthcare careers where you can donate your time to volunteer at those locations just to express your thanks to the nursing profession or career. Sometimes nurses don't need expensive gifts. They just want to feel seen, respected, and appreciated. And just to say thank you is enough for a nurse to know that she is doing exactly what God intended for her to do, and that is to care for our loved ones. I have another question to engage my listeners too. Who is the nurse that changed your life? If you could share that in the chat, whether you're watching now or you just happen to watch the replay, if you could share and answer this question, who is the nurse that changed your life? Whether you're a nurse or whether you experience being cared for by a nurse, who was that nurse that changed your life? If you could answer that in the chat. Now we're going to the segment three of today's The Blue Scrub Club show. Segment three is going to talk to you a little bit about nursing levels. You know, CNAs are a part of the nursing team. CNAs are certificate holders. They hold a certificate in caring for people who are ill or in certain facilities. They care for our patients and help with the team care. Then you get into the degrees where people are licensed to do what they do, and they had to take a licensure for whatever state they are working in. And some of the states are compact states, so that once you take the exam, you are able to work for certain states that are listed as compact states. And I will talk a little bit about some of those compact states before we finish today's um, segment of the Blue Scrub Club show. So, yes, licensed practical nurses and licensed vocational nurses are real nurses. And you heard that on here today from the Blue Scrub Club show. Some people are under the impression that only registered nurses are nurses. But believe it or not, licensed practical nurses and licensed vocational nurses are real nurses and had to take the NCLEX in order to practice. Licensed practical nurses and licensed vocational nurses provide basic nursing care under the supervision of a nurse and physicians, which means that nurses as LPNs and LVNs can take care of patients by taking vital signs, administering medications, doing wound care, assisting patients with daily living tasks. They can do home care. They can do long-term care reports. They can do administrative work. In some instances, they are considered as lead nurses when they have been in their practice for a long period of time. You have um, licensed practical nurses and licensed vocational nurses who are considered as supervisors who supervise other people under their care. Um, you know, there is a fine definition through following the scope of practice for a vocational or a licensed practical nurses as far as the skills that they are able to do. And believe it or not, it is really a wide range of tasks that a licensed practical nurse or a licensed vocational nurse can do in nursing. And I am a proud licensed practical nurse who have been a nurse for 26 years and really enjoy caring for people and really enjoy my profession as a licensed practical nurse and know that I am a real nurse. And if you have came across me in my work, you would already know that I take pride in caring for my patients and I really advocate for them as well. Here is a talking point that I would love for you guys to answer in the chat, whether you're watching now live or if you're watching the replay. LPNs are often the backbone of bedside care. If you can remember a licensed practical nurse who took care of you when you were a patient in the hospital, or if you don't remember her name, if you could just remember or tell us a little bit about her bedside manner when she took care of you, and if she was that nurse. When I say that nurse that gave you the utmost respect and was very compassionate to you as a patient. Now we're going to talk a little bit about registered nurses. The definition of a registered nurse. A registered nurse coordinate and manage patient care. That means they can complete all of the duties as a CNA, all of the duties as a licensed practical nurse or licensed vocational nurse, because the very first year of school, whether you're going for a licensed practical nurse or a registered nurse, are basic care for any um, patient across the board. And the first year of a registered nurse program and a practical nurse program is the same. The additional duties that a registered nurse can do is they can assess patients, they can administer treatment, they can create care plans, they can do a lot of patient education, and most of all, they are the primary supervisor of the nursing team to be sure that everyone is practicing within their scope of practice. That is the important part. And if you are wondering what can a CNA do as a certificate holder, it is at the Board of Nursing in the scope of practice book. You can order that book. There is a charge through your nursing organization for your state. You can get that book and you can see all of the duties that a CNA can do, all of the duties that a licensed practical nurse can do, and the duties that a registered nurse can do, and all of the other specialties that come after that. The talking point for registered nurses is RNs play a major role in decision making and patient advocacy, which means that registered nurses are held at a higher standard than licensed practical nurses because they're given more duties and responsibilities um, when it comes down to their scope of practice. Now we're going to talk a little bit about nurse practitioners. Nurse practitioners are registered nurses who go back to school to do more advanced practice as a nurse, who can diagnose illnesses, they can prescribe medication, and they can manage treatment plans. As you knew before, I said that registered nurses, they create care plans, but now we're getting into management and treatment of patients. And this is where nurse practitioners come into play. Now, there are several specialties in being a nurse practitioner. You can do family practice, that's where you take care of people from age 1 up until age, now people are living to see 100 plus years, so they can take care of a wide range of patients. You have pediatric nurse practitioners have been taking care of mom and baby through birth all the way up until they are 18 years of age, except for when they're medically fragile. Some of those children stay with their nurse practitioners, pediatric care until they're 25. I have also even seen some medically fragile kids that are 30 that are still being cared for through their NPs that are doing pediatrics. You have mental health nurse practitioners. You have women's health practitioners who take care of women's health. You have also acute care um, nurse practitioners. And it goes on and on. There are several other um, advanced practice nursing titles and duties that are out there as well. I can't possibly name them all, but I want you to know that nurse practitioners bridge the gap between nursing and medicine. They, it takes a lot of education, dedication, integrity, and advocating for your patient and your patient care that a nurse practitioner gives to caring for um the public and caring for our people through their illnesses. And also, you know being that they already have that compassion and advocacy experience to advocate a lot for their patients and be sure that their patients get what they really need. That is the importance. Now we have our DMPs. You may hear it as initials. In every career, they have acronyms, and in nursing, it's no different. You have CNAs who are certified nursing assistants. You have CMTs, which are certified medicine technicians. You have LPNs who are licensed practical nurses. You have LVNs who are practice, vocational practice nurses, and you have registered nurses who are RNs, and now you have nurse practitioners, which are in specialties, and now you have DNPs, which is a doctor of nurse practice, which means they have a doctorate degree. In nursing, a DNP is the highest clinical nursing degree, which focuses on several different points in nursing and different parts of the healthcare system. They can focus on leadership, they can focus on healthcare systems, focus on education, and advanced patient care. Some of their roles are healthcare leadership, where they are administrators and things of that nature. You have policies that they develop. They're in teaching, they're in research, they are clinical expertise in nursing. Um, they are at the top of the nursing ladder. They have been through a lot of training, a lot of education, a lot of, giving people um, what they need in nursing. And they have worked with several medical doctors, physician assistants, where they are a part of the healthcare team as well. Now we're getting into our fourth segment where we are now winding down and we're going to talk about some specialties before we finish the Blue Scrub Club show. Let's just dive right on into some of these specialties and discuss the difference in nursing specialties so that you can be more informed as to what type of specialties are out here. I cannot name all of the specialties, but I will go through a broad aspect of what some of the specialties are. We have pediatrics, which is from birth to, as we discussed before, 18, and or depending on the level of um comfort for the kid, and with some of the medically fragile kids, a kid could see a pediatrician all the way up until they are in at least 25, 24, 25, and in some cases 30. It just depends on their illness and what they need and their comfort level and going to a family practice. Then you have the emergency room nursing. The team that is working in the emergency room, they also have another certification that you can get in the emergency room, ICU, labor and delivery, and other specialties that RNs can get as well. Um, ICU and critical care. Some hospitals combine those three specialties together and put the nurses in a residency, which is called, which is where the registered nurse will go through a residency for a year or two, and they will rotate between the emergency room, ICU, and any of the critical care units. The critical care units, I can remember some, but not all. You have your NICU, your PACUs, your PICUs, um, different ICU units that take care of a specific target part of your body. You have labor and delivery. Um, you have mental health, you have home care where nurses go into people's homes and care for them, whether it be a nurse coming to help with maybe drawing blood or doing wound care, or a nurse who works in the home with a one client and care for that client for either 8 or 12 hours a day. You have hospice nurses. Hospice nurses are very special nurses, and they care for patients who are, um, as I say, transitioning. And it takes a special nurse to be a hospice nurse. You have school nursing, you have public health nursing. Public health nursing is working in a community. And not only taking care of the patient in public health nursing, but taking care of the family as a whole when it comes down to public health nursing. It's not just taking care of that patient, it's making sure that patient have resources and the family have resources as well to care for their loved ones. You have geriatric specialties, you know. Nowadays, it's hard to determine where that thin line comes in when it comes to geriatric patients. Some people say 50, some people say 60, some people even say at a higher age. But people are definitely living longer. Um, I'm not quite sure what is now considered for the statistics of the end of 2025, how long or what age Patients are transitioning. I can remember, I would say about 3 years ago, that there was a couple, and one was 115 and the other one was 116 years old. I'm not sure what state that was, but yes, people are living much longer. You have surgical nurses. Again, as I was telling you about the different ICUs, where you have your NICU, which is your neonatal intensive care. You have your PICU, which is a part of the primary care ICUs. You have dialysis, where a lot of patients now are on dialysis, and they have a lot of dialysis center. So it's a lot of different nurses in dialysis. You have rehabilitation. Rehabilitation can be for a lot of specialties. You have rehabilitation for medical, you have rehabilitation for substance abuse. It is a large range of specialties out there. You even have some nurses that go into law, where they do a lot of work for law offices when it comes down to medical insurance, um, review of charts and patient care, you know. So, here is another question that I would love for my viewers to answer. Again, whether you're on the Blue Scrub Club in person live right now, or whether you're checking the Blue Scrub Club replay. What I would like, if you could choose any nursing specialty as a nurse, which one would you choose? And tell us why you would choose that specialty. I told you guys why I would choose that specialty, but I'm just curious as to what nurses are listening to the Blue Scrub Club, and what is your background? Okay, so I'm Charlene Harrod, a woman. I am a nurse who have done a great deal in my healthcare career. I started my healthcare journey about 2 years after I left high school, and I've been in healthcare ever since. I graduated from high school in 1985, and I started right into healthcare in 1987. I've done pediatrics, home care, ambulatory services, emergency services. I've worked at prisons. I've done travel nursing, which was an exciting to go to the West Coast and work as a nurse. Was different for me. The scope of practice on the West Coast is a lot different than on the East Coast. The scope of practice for California was a lot different. You could do a lot more in California than you can do in the state of Maryland. You should always, when you're a travel nurse, get your nurse practice act booklet from that state, so that you'll be sure that you're not doing any practice or scope of practice that is not warranted in that state that could jeopardize your license. So pay very close attention when you're working in a different state, because it may be something that you can do in your state that's not acceptable in another state. And those are questions that you ask when you're a travel nurse, so that you be sure that you're working within your scope of practice and that other state. Now we're winding down, and we're coming to a close for this episode of the Blue Scrub Club show. So, this is our fifth segment, and we're going to talk about the reality of nursing. These are just some of the discussion topics that happen in nursing that we have to, think about self care and think a lot about as a nurse. When it comes down to burnout, you should know some of the signs and symptoms of burnout so that it doesn't um, interrupt your care as a nurse. Um, think about staff shortages, and it's okay to go to administration and give some of examples as to how that facility or institution can retain staff and help with scheduling. Every institution looks forward to staff coming to them. I mean, when you go to them, just be very professional when you're talking to them about staff shortages and maybe giving some suggestions as to how you could help your unit out or help that institution with staff shortages. The other thing is be mindful of mental health issues when it comes down to nurses on a unit, when it comes down to specifically your career as a nurse, or you working with other healthcare professionals, and how you address them when they're having mental health crisis. Nurses are human too. We have the same illnesses and responsibility for our work life as you do in your regular careers and jobs. The other thing is pay attention to being fatigued. Have compassion for your fellow nurses and your fellow healthcare team when it comes down to recognizing whether they're having a mental health crisis or whether they are emotionally stressed. Have some compassion for your fellow workers as well. Um, and the importance of self care. I do know that working in the ER, it has changed a great deal. When I was working as a licensed practical nurse in the ER, I can count numerous times when administration came through the ER with gadgets for us to they were giving us as stress reliever balls and spinners, and just coming through giving us snacks and asking us how our days are going. That is something that we as nurses look forward to. And not to mention just the ER, because they would go to different units in the hospital to be sure that on all shifts, because I used to be a night shift nurse in the ER. So on all shifts, administration would come through with a cart or send some of their administrative staff through the hospital on certain days to just say, I see you. That's some of what nurses look for. We look for people to come through and just say, I see you. You're doing a wonderful job, to offer us snacks and gadgets. You know, some hospitals, they come around and they have like massages you can do. One hospital that I worked in, they had like a quiet room where you can go in and have recliner chairs that had massages where you could do a mini massage during your lunch break, or if you had a bad day, somewhere where you can go and color on the board. Those are helpful things, and those are things that people can also give to nursing units to help boost the morale of nursing, and to just say, I see you. I wrote a book, A Silent Epidemic on Nursing and Depression. And my Subtitle was "The Only Thing More Exhausting Than Being Depressed is Pretending That You're Not." So I want that to be your takeaway from the show today, that I want you to think about is a silent epidemic is nursing and depression. You know, the only thing that's more exhausting than being depressed is pretending that you're not. Seek professional help. Psychiatrists have psychiatrists, So if you are a nurse who was going through a burnout, mental health illness, um, compassionate, fatigue, emotional stress, please seek attention. And this is my final closing. To every nurse listening tonight, I want to say thank you. I want to say happy Nurses Week to you. Thank you for your sacrifices. Thank you for your compassion. Thank you for your tears and your strength. And most of all, thank you for your service. Whether you are a CNA, a CMT, a LPN, a LVN, a registered nurse, a nurse practitioner, a DNP, which is a doctorate nurse practitioner, a student nurse, or a retired nurse, no matter what type of nurse you are, I am extending a happy Nurses Week from the Blue Scrub Club show. And here's my final quote to you guys. Nurses dispense comfort, compassion, and caring without even giving a prescription. So, from me to you guys, happy Nurses Week. When you come upon a nurse, thank her for her services. And please follow the Blue Scrub Club show. Share tonight's episode. Thank a nurse this week. Support your future nurses. Support your fellow nurse. Continue to tell the nursing stories so that you can promote more nurses to come into this profession. This is Dr. Charlene Harrod, a woman, better known as the nurseologist, signing out and thanking you for all your nursing service and what you give to the nursing profession. Thank you, and come back next week and enjoy the show. Come back next week so that you can see what is new and happening on the Blue Scrub Club. Thank you and have a blessed weekend.
Trivia's Inspirational Radio would like to inform you that the views, thoughts, and opinions expressed in the following show are solely the sentiments of the participants of the show. Trivia's Inspirational Radio Network is not responsible for content. As always, thanks for watching and enjoy the show.